Welcome to The Explainer. Okay, let's just dive right into this. For millions of people around the world, taking a simple breath of air isn't exactly simple. The everyday struggle of asthma can literally make just walking up a flight of stairs feel like you're running a marathon with a straw in your mouth. But today, we're looking at a completely fascinating natural solution that might just change the way we approach respiratory health altogether. So, I want you to ask yourself a quick question. What does the future of asthma treatment actually look like? Normally, when we think of respiratory care, our minds immediately go to modern medicine, right? Chemical inhalers, steroids, biological injections. But what if the next big breakthrough isn't synthesized in a lab somewhere, but is actually rooted in rigorously tested traditional wisdom? Today, we're taking a journey from the heavy burdens of modern medicine straight to an ancient remedy that science is finally, definitively validating. And the stakes here couldn't possibly be higher. We are talking about an estimated 100 million people projected to be affected by asthma by the year 2025. To put that into perspective, in developed countries, about 1 in 10 people already suffer from this condition. That is a massive chunk of the population. And look, while conventional treatments, your inhaled corticosteroids, your beta-2 agonists, they are absolutely essential for keeping people breathing. But they come with a really heavy toll. Long-term use can trigger some rough side effects, like rapid heart rates and oral infections, not to mention the immense mental and financial burden on the patients themselves. People are actively looking for something, anything, that's a little easier on their bodies. Section 1. Meet tiger milk mushroom. This right here is a traditional Southeast Asian remedy that has literally been used for generations. And based on a brand new systematic review of the latest science, it might actually hold the key to better breathing without those harsh side effects we just talked about. Now, scientifically, this fungus is known as Lignosus rhinocerus. And just to clear things up right away, no, it doesn't involve milking any big cats. The name is purely folklore. What it actually is a highly prized medicinal mushroom that predominantly grows in total solitude, entirely underground. It actually stores all of its powerful medicinal nutrients and active compounds in this tuber-like structure hidden beneath the soil. Section 2. Calming the inflammatory fighter. So how does this underground mushroom actually help someone struggling with asthma? Let's break down the actual mechanics here. Think of your airways kind of like the plumbing in a house. When you have asthma, those pipes don't just get physically blocked, they swell up from the inside out with this burning inflammatory fire. In an asthmatic lung, the immune system basically panics. It produces sky-high levels of allergy-triggering antibodies, and that leads to airway thickening, tons of extra mucus, and just a whole lot of swelling. The pipes are practically small and shut. On the flip side, you have a totally open, relaxed, healthy airway. Our primary goal is to get from that squeezed, inflamed airway back to a relaxed, open one. And this is where the mushroom steps in. Now, the scientific literature uses a ton of heavy medical jargon. They talk about reducing eosinophil infiltration and suppressing Th2 cytokines, but let's translate that for a second. Basically, the mushroom acts as a mediator that completely silences the immune system's overactive alarm bells. Those are the eosinophils. It also clears out the structural traffic jams caused by all those excess allergy antibodies clogging up our lung highways. It literally tells the body to just stop overreacting, effectively turning off that inflammatory fire inside the pipes. But you're probably wondering, does it actually work in real people? Well, yes. In a human clinical trial, participants took just a 300 milligram daily oral supplement of the mushroom for 3 months. And the results? Fantastic. It significantly decreased key inflammatory markers and totally reduced oxidative stress in the lungs. But here is the most impressive part. Patients saw a 27.2% improvement in their lung function ratio. They were objectively breathing so much easier and reporting a massive upgrade in their day-to-day quality of life. Section 3. Relaxing the airway muscles. Okay, so it puts out the fire inside the pipes. Awesome. But asthma has a second, equally terrifying component. It's not just swelling on the inside. It is a physical squeezing from the outside. The muscles wrapped right around your airways just tighten up like a vice. So let's explore how the mushroom handles part 2 of the problem. The studies revealed something pretty incredible here. Tiger milk mushroom acts as a potent, natural muscle relaxer for your lungs. How? Well, for a muscle to contract and squeeze, it desperately needs calcium to rush into its cells. The active compounds in this mushroom actually step in and block that calcium ion influx. I like to think of it as literally cutting the power supply to the muscle's squeeze reflex. And what's really fascinating, especially for the science geeks out there, is that it does this entirely independently of the standard beta-2 receptors that most chemical inhalers target. It's just a completely different, totally natural pathway to force those airway pipes to finally let go and open up.
Section 4, checking the scientific proof.
Now, I know exactly what some of you are thinking right now. An underground mushroom that fixes both inflammation and muscle spasms? Sounds a bit like magic folklore, doesn't it? Well, let's pull back the curtain and actually check the scientific proof. The systematic review we are looking at today demands the absolute highest level of rigorous, peer-reviewed evidence. Take the Prisma flow chart, for example. You can think of it as the ultimate scientific funnel. The researchers started by looking at 182 potential studies on this mushroom, but they definitely didn't just accept everything they found. They ruthlessly filtered and scrutinized the data until they were left with only the absolute most reliable, highest quality 9 studies. That's 8 animal and in vitro studies and 1 human trial that actually survived the cut. And just to prove how unbelievably strict they were, we have these risk of bias assessments, the Robbins 1 and Circle tools. Honestly, I just call these the ultimate scientific BS detectors. When you look at the data, all those green circles with the plus signs, those green marks definitively prove that the studies passed the test for incredibly low bias and really high methodological quality. So this isn't just someone's anecdotal evidence. The effects of this mushroom have been meticulously vetted by modern, strict scientific standards.
Section 5. A breath of fresh air.
So, bringing it all together, what does all of this data actually mean for someone out there struggling with respiratory issues? The absolute crucial takeaway here is the 2-in-1 power of the tiger milk mushroom. I mean, it is incredibly rare to find a single natural agent that tackles both sides of the asthma coin so effectively. First, it puts out the inflammatory fire inside the swollen pipes by hushing those immune alarm bells. And second, it acts as a calcium-blocking natural muscle relaxer to stop the tight squeezing from the outside. And the whole thing is backed up by a low-bias, highly rigorous systematic review. It's really emerging as a super promising, evidence-based adjunct therapy that could work beautifully right alongside traditional treatments. I'm going to leave you with this final, kind of provocative thought. Could looking back into ancient traditional remedies actually be the key to our modern medical future? It's pretty wild to think that a mushroom growing completely silently underground in Southeast Asia, a literal piece of ancient wisdom, could, when rigorously vetted by modern science, be exactly what millions of people need to finally breathe a little easier. Thank you so much for joining me on The Explainer today, and keep your curiosity open.